Thank you, Mr. Mayor. It's really wonderful hearing the two of them speak about all the wonderful work that's gone on from our volunteers and residents. And personally, I'm really delighted about this motion. It recognises the great work that our volunteers have done throughout the COVID period. And my personal thanks goes out to my husband, who volunteered to be a coordinator for the ARC to allow me to focus on my duties on the COVID front line. I was fortunate to be able to carry out shopping duties later in the pandemic, allowing me to meet residents who would have not previously engaged. For me, this motion identifies the need for ongoing support for voluntary organisations, of which I've seen invaluable for the residents I serve. Alone, the ARC helped over 400 Aldershot residents, with Aldershot Park ward creating the most demand. Moving forward with council support, I can see the following areas for a collaborative approach. Unfortunately, some of these roles potentially could be paid. However, in the ongoing circumstances, we must rely on volunteers. So the three key areas I have identified for voluntary services are working with health and social care, improve isolation and loneliness, and food poverty. During the heightened phase of the pandemic, GP surgeries were liaising with voluntary groups to assist the vulnerable and shielding. GPs were able to prescribe medication and send them straight to the pharmacy, picked up and delivered to residents within a few hours. What we know is that getting medications to people early can prevent hospital admissions. Volunteers often picked up on some social issues that hadn't been identified whilst delivering shopping. Personally, I was able to refer to specialist services such as social services and the fire brigade to support residents with issues. There are other ways in which volunteers can help with health, especially in the acute sector, but I haven't got all night. Improving isolation and loneliness would be an easier task post-COVID, as many voluntary sectors delivered befriending services. And a great example was 4 isolated and lonely elderly residents who were put in touch with each other to offer their own befriending service to each other. And one resident described it as life-changing. So volunteers can be used for social prescribing. Food poverty was significant, and areas for volunteer involvement could be providing meals during school holidays, cooking lessons, something the government didn't quite think about when administering their food packs, community gardens for fresh fruit and veg. So I've only identified some of the areas where volunteers can help, and with the council support, we can look towards working with our partners to deliver much needed services in our community. So there was an additional amendment put forward to this motion, and that recognises the hard work of public services, especially my colleagues in the NHS. Some of us will have experiences that will never ever leave us. I'm pleased to see this motion gather cross-party support, especially after being informed by a Conservative councillor that choices facing nurses' pay was potholes or pay rises. I'm glad that whatever the Conservative group might say amongst themselves behind closed doors, it is not repeated when the opportunity comes to signal their virtue. Although it has been reported by the media that nurses are being given pay rises, the truth of the matter is that due to austerity, the average salary of a nurse has fallen by 8% based on Consumer Price Index, according to the Royal College of Nursing. So despite the public in their millions, and including those in this chamber, taking to the streets to applaud gratitude for the NHS and other key workers, when it comes to add some substance to the collapse, the Conservatives have fallen silent. I would be grateful if the appreciation shown in this council chamber by Conservative members was reflected by their peers in government, because claps and recognition do not pay bills. Now, this motion, I am taking it away somewhat from the community value of this motion, and this motion thanks volunteers and public services for stepping up to the plate and ensuring continued support to meet the needs of our residents. And I'm very, very grateful for the support that was given to my residents in Aldershot Park. So on behalf of my colleagues in the NHS and for other public services, I would like to thank you all for the well wishes.